computer. All right, welcome everybody to the Virtual Care Partners Training Module Certification class. This will be Training Module 1, and as you can see on your screen, the title is Value Proposition and Physicians for Physicians and Patients. Now, let me share with you, okay, we will have 8 modules that will all live where you could watch the recordings, and there will be a certification test at the end of all 8. And this way you are up to speed on your craft, which is bringing the Carey Health product into the doctor practices. Now we're going to start off with some very basics. Some of the things that you may see tonight may be very familiar to you, but we are recording Training Module 1, and we're going to turn this over to our Clinical Innovation Officer, Dr. Dan McDyer, who's a board certified OBGYN in Florida. And Dr. Dan McDyer, I really appreciate all the effort that you have put into these trainings. And I just really want to turn the call over to you. And everybody has been waiting with bated breath for these training modules to begin. So thank you very much, sir.
Thanks, Jeff. I appreciate you taking the time to put this together for us tonight. And this is going to be a life-changing event tonight. No, but actually, you know, whenever you're starting a business and trying to assemble all the necessary elements to create success for yourself, you need the foundational elements. And that's what this training program for certification is going to be, is just to bring you to a whole new level of understanding of not only who you're dealing with, but what you're dealing with and why you really truly have, what I've said before, an opportunity to leave a fingerprint on the transformation of healthcare. I was just on the phone earlier today, I don't want to get too far off track, with actually over the past 2 days, spent about an hour and a half on phone calls with people that have businesses that are actively pursuing a telehealth model to partner with, and everything they've seen in the marketplace. They've looked at them all. They either get shunned by them, or they have no interest, or they don't have the capacity to do what we can do for them. So they're very excited about this model, and that's why you and I are in such a perfect position to make changes happen that are going to impact people forever in terms of the healthcare, which is the most important thing for us to have. So tonight we're going to go through this first training module. I'm very excited to have the opportunity to assemble some of these training modules together for you all. And I want to kind of put you in the mindset of how this is going to happen. Tonight's just an introduction to what this particular training module will be. This is actually going to live in a learning management system, which you'll have access to through your back office in the company. I don't know if you're familiar with it, but it's called By Design, is assembling this for us with our programmers. Unfortunately, that particular system can't run this learning management system like we need it to, so we're going to be partnering with somebody else. So you'll be directed to a new website. It'll be a blind transition, and then these slides will appear that you're going to see tonight, along with oral edification. I'll be explaining them, and there'll be like a voiceover, and then at the conclusion of the slide presentation there will be a test, and we'll want our VCCs to pass that test with an 80% score or higher. And after that particular training module is passed per se, then you can move on to the next element or the next training module. So we're starting with the basics, and we're going to build to a great big building so you can be really successful in understanding what we're doing and why, and what you have to work with. So tonight we're going to talk about what you probably can put this together for yourself, the value proposition for physicians and patients. And really what I love about this platform of technology that we're assembling with Carey is that every single person that involves themselves with it, from patients to physicians to you all as VCCs, has an opportunity to win. To me, that's the ideal formula for anything that we're putting out into the business world, where everybody wins. And tonight we're going to talk about the two people that win the most, which are the physicians and patients. And really, it's for physicians, you know, we're giving them an opportunity to salvage their practice. It's about making their practice more robust, more financially stable and successful, so they have the opportunity to make choices about what they want to do with themselves. So let's get on to this. We're going to talk about why that's the case. The value for physicians, the proposition for physicians in this is really, number one of the most important things is to counteract the declining reimbursement that's occurring out there in the insurance world, and to increase the profitability of the practice. And where does that come from? Where does that increased revenue come from? It comes from the monthly memberships that you're going to be offering to their patients to enroll as members of Carey Health. And then also revenue from previously unpaid work. We've talked about this many times. I do telehealth. I did a couple calls on my way here, on my way home right before our board call started. And by the way, if I do seem a little disjointed, I just got off of the phone or after a webinar for a 3-hour board call tonight. It was a marathon, just finished as we were starting this, thank goodness. So anyway, revenue for previously unpaid work. That unpaid work is the free telehealth we've been doing, and it can be monetized very simply with Carey Health, and it's never been capable of being monetized in any iterations of telehealth prior to this for us with our own patients. So that's really, really important. And I think literally over my 24-year career, this makes my stomach knot up when I think about it. I've probably done well over $1 million worth of free work via telephone calls. It's unbelievable. And then also the other revenue stream is from the concierge conversions, which we announced last Wednesday night. The patients have an opportunity to become members or concierge members of their physicians' practices as we pull all of these elements together. And that's a significant revenue stream for the physicians. So it's a huge opportunity to make a lot of extra money. Oops, I went through, sorry, second page. Well, another important thing, the lifeblood of a physician's practice, truthfully, is new patients. And without that, our practice will shrivel up and become non-existent over time. And a lot of my colleagues in my specialty see that happen when they stop doing obstetrics and isolate themselves to just gynecology. The new patient flow diminishes a bit, and the practice just slowly undergo attrition over time because that infusion of new young people into the practice starts to decline. So the Carey Health model that we are assembling through Virtual Care Partners is going to allow the physicians to acquire new patients. How is that going to happen? Well, we have the geolocator map so that when physicians appear on that and patients seek care after hours, if they don't have a physician in that specialty already, they'll be able to choose one from the drop-down box, and then automatically, if that physician establishes a good relationship with that patient that evening or that weekend or whenever that care takes place, since they have a brick-and-mortar setting too, there's a high likelihood that patient is going to come see them in the office when it's necessary to see them. So it's a huge source of new patients. This has never been done before, guys. Never, ever has a marketing program been assembled like this. And it's a perfect time in the marketplace because people are always using the internet for everything they possibly can, and this just fits right into that. We are going to be on the internet having advertising for our physicians' practices to let people know that, hey, yes, you can get internal medicine care at night and on weekends from a doctor who's local. It's never been done before, so that's very, very exciting, a whole new opportunity for new patients and for new doctors for patients who don't have one. They get a chance to meet them firsthand before they ever actually grace their offices. So really cool. Another really important element of this, which we've talked about previously, is halting the attrition of patients. Many of my colleagues are completely unaware of this taking place in a silent fashion, but they're feeling it. There are fewer calls at night and on weekends. They're starting to see fewer patients come through as new patients and for acute issues. And where are those patients going? Well, they're getting their care from several other sources. They're getting it from random telehealth providers like Teladoc and MD Live. And the problem with that, guys, is that, and just think about how big those companies are getting, whereas only 19% of patients are willing to see a random telehealth doctor, but still those businesses are growing and getting all kinds of cash infused to them from venture capital sources. So it's crazy. That's only 19% of the market is seeking care from those people. Just imagine what it's going to be like when your own doctor is offering telehealth. People feel very comfortable with that. The other attrition sources are the ERs and urgent care centers. When I'm not available or my colleagues aren't available to see their patients, the patients have to go somewhere. So either go to the random telehealth, they go to an ER or urgent care center, or to some of these other entities, some of the mega brands that are developing, like Cleveland Clinic is starting their own telehealth program. The Mayo Clinic is thinking about that right now, and some other huge sources. Even Walmart's getting involved in this. We've got CVS with their Minute Clinic. So all these entities are developing to start chewing away at the doctors' practices, and they're doing that successfully thus far. And we need to put a halt to that, and this is going to be a significant component that stops that attrition. For me personally, it's very important to use the telehealth and the platform in which you can document the visit you've had with the patient, because that reduces your liability. Whenever we interact with patients, we assume liability for the outcome of that patient and the proper diagnosis. And most of us, for instance, the 2 calls I took tonight on my way home, I haven't documented those yet. I just literally don't have time. And if I wasn't on this webinar tonight with you, I would have forgotten about those already because I was just on a 3-hour board call. So the liability issues are serious and they're real. And this helps eliminate that, which is a downstream cost that it could be a career ender for physicians. So we eliminate that. This also, very importantly, improves the relationship with patients. And really, that was one of our original goals with developing this new iteration of the Carry Health platform, which will be released on October 1st, is to improve the relationship between physicians and patients. Because without that, the whole equation starts to break down. And when we have that improved relationship, it's much more likely we're going to keep those customers, right? You've heard the old mantra probably in the marketing world and the advertising world, it's much less costly to keep a current customer than it is to go out and market and try to acquire new customers. So with this offering to our patients, we build a better bond and it's more likely they're going to stay with us. Shoot, even when they move away, like I had a patient who spent the entire summer in New Zealand and Australia on a well, I wouldn't call it sabbatical, I guess it was an internship with the some kind of a golf program. Anyway, I gave her my telehealth access so she could consult with me, and she did. From across the globe, I was able to give her some guidance about what was going on with her. So it was really cool, man. So we've got that relationship builder. It improves patient care. There's no doubt about that. The continuity of care is so important, and patients demand this. 56% of patients want that continuity if they're going to use telehealth. They want their doctor available. If not, they won't use it, period. That's what the surveys show. So the continuity of care is very important. It allows us physicians to deliver better care to our patients because we have that relationship built with them already. And then also, in my mind, we have an opportunity to improve patient care through the concierge options that are available. And with this release that we made on Wednesday night, the doctor doesn't have to convert their entire practice to concierge health. They can offer that as a component. So they can do a hybrid model of concierge care where there are slots available in the day for patients to be seen in a timely fashion, whereas the rest of the practice is just the routine. Or they can do a complete conversion. And when you have that time to spend with the patients as concierge patients, and there's less pressure to rush off to the next person, it really does deliver better care. You're able to learn more about the patient and talk with them and also advise them about the educational aspects of their disease process and the goals of the therapy, because that's really important for compliance purposes for the patients to understand what you're trying to accomplish for them. So overall, all in all, better outcomes for everybody. Very importantly, adopting telehealth, and especially the platform we have available, gives you a competitive advantage over your colleagues as a physician. The last data I was able to acquire was, as of 2014, only 15% of family practitioners had ever used telehealth. And that doesn't mean they're currently using it. They've just had an experience using it. So it's very small numbers of physicians that have ever used this. So if you're out there putting this into your practice and mobilizing it, you're ahead of the game, because this is where the future of medicine is headed. Every potential partnership that I've spent time on the phone with over the past month in my new role has complete understanding. Telehealth is the future. They have to be involved with it somehow, some way. So this improves the relevance of your practice. It meets the patient's demands and expectations. Like I've said before on some of our webinars, if you don't offer this as a physician, you're going to get left behind. Patients are going to demand that their physicians in the future offer this access to them, because they don't want to go to those strange facilities in the middle of the night, the ERs, the urgent care centers, where it's impersonal care. They want mobile access, they want convenience, they want accessibility, and they want affordability. And like I mentioned a few moments ago, 56% of patients will use virtual care only if their doctor is available. Otherwise, they don't want to have anything to do with it. And that's what you're making available to the physicians. You're making them available to that 56% of people who are seeking it but can't use it because they don't want to. A huge, huge benefit to our platform is it's essentially free to use. In the past, that's been an impediment to physicians implementing this into practice because it's rather expensive, but we're breaking that barrier for entry for them. So it's phenomenal. They can test drive this before they actually mobilize it into their practice. And this is pretty crazy. Somebody brought this up to me on Friday as I was driving up to North Carolina. You know what? Normally when a doctor leaves their practice, they pay for somebody to cover their practice. And another thing too, those 2 phone calls I took tonight as I was coming home, I paid to deliver that care to those patients. It's kind of strange. I pay about $500 a month on average for my answering service to pass calls to me so I can deliver free care. I guess, pat me on the back, I feel pretty good about it, but I'm getting mad about it actually. I can't wait till October 1st, to be quite honest with you. I'm really getting tired of it. So prior model, you paid to deliver free care. Here's the paradox. With Carrie's virtual care model, you're almost kind of getting paid to leave and not be available, because your patients, they're paying a membership fee and you're getting paid that month by month as a doctor to offer that membership to them. So literally, you are getting paid to offer virtual care to the patients. And then when you do perform the virtual care, you get paid again. So how cool is that? I mean, that's paradoxical, guys. That's amazing. So really, truly, what all this boils down to is we, as virtual care consultants and as business people, we're offering physicians something they've never had access to over the past 20 years, as managed care has just been beating them down to the point where they feel hopeless. We have the opportunity to offer them freedom by creating a more robust practice with improved financial stability from all the benefits we just talked about. And the result of this is lifestyle and practice choices. The doctors that you introduce this to will truly have the opportunity to change the entire profile of their practice and see fewer people and deliver better care. Everybody wins there. So that's the value proposition for physicians. I'm just so excited to play a role in this and to allow you guys and have you as partners in this and bringing this and presenting this to my colleagues. I can't wait for them to see this. I'm so excited about it. So what is in it for the patients? We said everybody gets a win here. Well, of course they do. The patients hugely desire convenience. And the beauty of this is they get to see their doctor, which we talked about earlier, or a covering physician that their doctor is designated capable and responsible enough to deliver care to his or her patients. So your doctor literally travels with you as a patient. I mean, like I told you, my patient went to New Zealand and Australia. I went with her. I wish I could have gone, but I was there virtually, which is really neat. So it's like having a doctor with you all the time. And the really cool thing about this convenience, in which something that all of my patients have commented about, is you get to see your doctor when you need to be seen. You're not sitting in the waiting room waiting to be seen. You're going about your day, doing your routine. And then when the doctor's ready to see you, just the app goes off and says, okay, he's there. You're not sitting around waiting. And then the other component is the 24/7, 365-day-a-year availability. It's really truly like having a doctor in your pocket. Who doesn't want that? Really, my family and my neighbors here in my neighborhood, they use me all the time, and I don't mind that. I mean, I love helping people. That's one of the reasons I went into this, man. I just felt that God gave me these skill sets and abilities to learn, and I just love transferring that skill set to other people. Now I can be in people's pockets, I guess. So anyway, improved care. We talked about this on the doctor side. Well, it's the continuity aspect again. It's your doctor or his or her colleague who's delivering that care to you, which is so important, because it's when your doctor endorses somebody in a way and allows them to cover their patients, that gives the patient some sense of calm and ease to know that they're in the good hands when they're being seen by somebody other than you. With the accessibility that we talked about a moment ago, or the convenience, it's really important when people can be seen right away, because the sooner we can intervene with a problem, the sooner they're going to get better, and the less likely those problems will get worse and get to the point where they need to get admitted to the hospital and things like that. So the accessibility does render better care and allows us to intervene sooner. And then, of course, which we talked about a moment ago, the concierge program gives patients that ultra level of care that can be delivered from their physician, with the time and the relaxation to interact with each other in a more intimate fashion. I guess I should use that terminology carefully, but you know what I mean, where they really get to know each other and the families and things like that. Because there's so many other components to healthcare other than just the problem and the medicine. It's actually knowing what's going on in that person's life and with their family, and sometimes that does play a role in what's going wrong with them, actually. And that's really what attracted me to medicine, is I just love learning about people and seeing the interventions that I'm able to make improve their lifestyle and their family life and things like that. So a lot of us really get excited about that. Another value for the patients, of course, is this is extremely affordable, especially compared to the current system of healthcare delivery. Think about this. There are direct costs, certainly, when you're not available for your patients and the patients don't have access to the doctor. They get the cost of an ER visit. And I just looked this up today. The average cost of an ER visit in 2017, according to the National Institute of Health, was $1,230. Average cost, $1,230. And in the urgent care center cost, it's $155 average to be seen at an urgent care center. That comes out of your deductible typically. I'm going to validate that because I think it's a little bit higher than that, honestly. And then there are the indirect costs, the things that we don't necessarily think of all the time, but it's the inconveniences. It's the time from missing work. And a lot of people, when they miss work, guess what? That's coming out of their vacation time or their PTO. That's what's shortening my life right now. I know when my patients are sitting there in my office waiting 45 minutes to be seen, they've already taken 30 or 45 minutes to get there. So they're losing vacation time. It's actually costing them money. There's also the opportunity to not have to get childcare when you have the access to your doctor virtually like this. And the wait times. I mean, like we talked about a moment ago, the wait times with the virtual care are essentially nil compared to the wait times in an ER or an urgent care center, or even the doctor's office for that matter. And then there's improved access to the office appointments via our basic membership, $29 a month and $49 a month opportunity. And then the concierge membership, which is $99, gives you that real VIP type of a feel, red carpet entrance into the practice. So there's the accessibility is really important, being able to get seen in the brick and mortar setting when the virtual setting may not be the most appropriate way of taking care of the problem. So lots of opportunities for better care there for the patients. So really, in conclusion, putting all of those pieces of the puzzle together in the value propositions in Carey Health's virtual healthcare model, what we've done is we've created as perfect a system as we can possibly create. We've truly bridged the gap that exists in patient care. Like we talk about in our webinars, doctors are only in their offices about 25% of the week. So that leaves 75% of the week without access to care. So we're bridging that gap, making your doctor available to you. And that's our goal. That's our job as virtual care consultants, to get those doctors into the system, and then they enroll their patients. And at the same time, as virtual care consultants, we can also start getting the masses of patients becoming members, because they will start asking their doctor, hey, why aren't you a Carey Health virtual care provider, Dr. McDyer? You need to get looking at this. This is the future. I want you to be available, or one of your colleagues to be available for me. So that's really important for us to understand that role that we play in this whole entire process. Simultaneous acquisition of members and physicians to grow a huge network across the country, so we can really build a big bridge and create a solution to the gap in patient care. We enhance the physician-patient relationship, one of our main goals, that in creating freedom for our physicians. We're saving healthcare dollars. That's really important because we're getting close to 20% of our GDP going to healthcare. We cannot afford that, guys. Some things, it's already broken. I don't know how many Band-Aids and gauzes we put on this, but it's about over. This is going to be one of the main triggers for change and savings. And really, like I mentioned just a moment ago, I got ahead of myself. We are truly creating freedom for physicians, freedom to make choices in their practice, things they never dream of, actually, giving them hope that something can change for them. And that's what you're delivering to them, is a service that gives them hope, and hope for change, and actually not just hope, but true change in their practice, as we help them implement this appropriately and successfully, and give them all the strategies they need to make this work well and efficiently for them, which will be one of our trainings down the road. So that's a kind of a good segue into one of our future trainings. So with that, I think there are no more slides, guys. Look at that, a blank screen. So I'm finished. Now what will happen is, I think that went pretty well. So I think we might even use that as a recording for maybe our testing in the LMS system. We'll see how that went as we review the recording of this. But I'm very excited to